So sometimes people are on some medication. For example, I'll just tell you something now here, because many times it is about, for example, if a person is taking some medication, for example, aspirin, Coumadin, Plavix, blood thinners, etc., then in the book it is written that you have to ask the person to stop that like few days before, and then you can do hijama, simply because it's hard for the person to stop bleeding when you make hijama pricks. Well, that's fine, but honestly speaking, in my practice, what I have seen, that I have stopped asking these things, because I feel it is not a good idea to stop people's medication if the doctors they have suggested, because if they are taking blood thinners, there's a reason behind that why they are taking it. So it is better not to interfere in that system. And also, but you take precaution when you are doing hijama. Make the smallest possible pricks, so everything in control. And generally, I suggest and recommend, and I do make smaller pricks. I tried this, unless in some cases that I don't see any blood coming out, then I go a little overboard. But generally, I try to limit my cuts to a very smaller version, smaller pricks, and then you just put the cup, and then comes, you can have 2 sections if you want, 3, but things are in control. So in this case, it's better idea not to ask them. And even then, if you ask, for example, if a person is taking some blood thinners or aspirin, then its effect actually lasts from 3 to 7 days. How many days would you stop this medication? So it's not really a good idea. Now, third thing I would tell you, in my experience, what I've seen, most of the people who are taking these medications, already their blood is viscous and thick. So in most of my cases, I've seen that there's no problem actually. But from the beginning, you make smaller cuts. And I'll give you a tip, practical tip how to start. Sometimes, for example, you find that you have to do hijama on certain areas, and you just figure that out beforehand, that these are the 3 or 5 cups which are more important for this person. Now, before making pricks on these points, make 2 additional pricks. For example, just take stress points on the sides of shoulder, and so this is just to test the bleeding pattern of this person. Make a smaller pricks, go with the smallest version, and then see what is the bleeding. So it will give you an idea that how deeper, how long, bigger cuts you have to make. Then if someone's blood pressure is down, so it is advisable, do not touch the lumbar region, because many times if you just touch the lumbar region, his blood pressure can go down further. It's not a good idea. So, but if someone is hypertensive, high blood pressure, this point is the best point for him.